There's not much to do when all I can is thinking about you. Not doing well, don't know where you are, 'cause you're not here.
Hi guys, welcome to another episode of Journey to Paediatrics. I think this is the 4th episode, and if you haven't seen the others, please go and check them out. I'll put them in a series so that they're not easily hard to find. So today I'm going to the 10th annual Botswana Paediatrics Association conference, and it's my first time there, so I'm quite excited and I'm looking forward to the day, and all the speakers that will be there today are quite amazing, so I'm excited. And I'm also looking forward to just networking with other pediatricians and other allied departments such as surgery and obs and gynae. So I hope you guys enjoy this vlog and you come along with me. This is basically what my journey to being a pediatrician looks like. I'm just showing snippets of what goes on in my life.
That he's a committed father and husband and a farmer, a pediatrician with a focus on kids, and I believe he does a bit of cardiology, or a lot of cardiology actually. He's often known to say that he is retired, but he is not tired. And he has continued to work providing pediatric clinical care in Francistown, where since his retirement a few years ago, but he's not truly retired, as he's still quite an active member in the community and the medical field. Long MBBC age, and there's a lot of degrees and qualifications. But just in a nutshell, he's an adjunct professor and academic head of department in the Department of Pediatrics and Child Health at the University of Witwatersrand since October 2016. He's also the head of Department of Pediatrics at Rahima Musa Mother and Child Hospital, Johannesburg since 2014. He completed his undergraduate training at the University of Zambia and his pediatric postgrad training at Wits University in 1998. And his current areas of interest include medical education, pediatric emergency medicine training, and advocacy on our public healthcare system. He's a very passionate teacher, very passionate pediatrician, and he'll be speaking about the partnerships that we have had as UB, the country, with Witwatersrand. Over to you, Prof. Thank you.
Textbook, Pediatrics and Child Health, is not me. I hope you will still come and take my photograph with me. I think you'll agree with me that the author, Hussein Kuvadia, and I are different. There's quite a lot of physical differences. We are two different people. We are related.
On a serious note, they need to see. You need to find one of them. Whatever temple, I can't remember how to be babies. I'm not a Friday afternoon. Kids want to go. Baba can't and you know, Pastor,
has come up with, and is eliminating preventable pediatric deaths, acute kidney injury by 2025. risk of acute kidney injury. So you should be able to identify those ones. And then once you have identified them, you have to be able to have things that good clinical skills and good clinical judgment to actually recognize that this is acute kidney injury and monitor it. And then there has to be a rapid response. Once I know that this child has acute kidney injury, I have to be able to start the management that I'll talk about quickly about that management. And you have to send the patient quickly to me for renal support because we do have renal replacement therapy in our country as well. And the last R is rehabilitation. Now you have to teach the parents and teach the caregivers and the patients to prevent acute kidney injury from happening again.
The peripheral type, but they also have supravalvular AS and congenital rubella. We've seen a couple in our setting. They have PPS as well, and also PDAs, and the rest. Usually in an autosomal dominant inheritance, but there may be recessive transmission, as mentioned in this syndrome.
The other characteristics of the procedure, how long is the procedure going to be? The onset of action, the duration of action, the half-life, the amount of time that it takes to recover from medications is different for each of these categories. So it's really important to know what you're trying to achieve, what the goal is before you administer these medications.
Baka tshwere tsa video.
Hey, if it's the face, yeah.
I'm on video. I'm not.
With our big boss.
So I'm going to go ahead and get started. This is a very exciting group of sessions. We have one slight outlier. Proxima is going to be talking about the future of research. We had to do a little shuffling. But the first three sessions are going to be something about the brain. So we're going to have a session on prevention of neonatal encephalopathy. We're going to have a session on neuroinflammatory diseases, and then one on functional neurological disorder. So our first session is going to be by Dr. Francois Dudu Rubgega. She is an obstetrician and gynecologist who currently holds a position as lecturer in the Department of Obstetrics and Gynecology at the University of Botswana, Faculty of Medicine, and at Princess Marina. She's also a consultant obs and gyne at Sidi Leha Private Hospital. She completed her training at the Pretoria Academic Complex, which includes 3 tertiary hospitals. Prior to this, she worked in private practice at Bopamoso, and her educational background includes a Bachelor's of Medicine and Surgery from the University of Botswana, her M.Med in Obstetrics and Gynecology from the University of Pretoria, of which she was awarded a distinction for her research, along with her fellowship from the College of Obstetrics and Gynecology in South Africa. She has received multiple awards and international sponsorship, and we are so happy to hear from our OBS and Gynae colleague today. Thank you.
And one of the reasons is fear of litigation secondary to cerebral palsy that is due to neonatal encephalopathy. So if we want our grandchildren to be delivered by skilled healthcare professionals, including obstetricians and midwives, we need to spend some time talking about the prevention of neonatal encephalopathy. And why prevention? As per the statement of Latin origin from the 13th century, it is better and more useful to meet a problem in time than to seek a remedy after the damage is done. With fetal causes, examples include fetal growth restriction, and intrapartum causes, examples include babies who have, or fetuses with persistent occiput posterior.
That's too busy.
Everyone is there. Nice. I want to grab my phone. It's Germany for me, child.
So just moving on to our medical officers, I'll mention the name in the end, you might know who it is. He graduated with an MBBS degree from UB in 2018, then completed his internship at Scottish Livingston Hospital in Moloplole. Then he was posted to Madinari as a medical officer. Then in 2020, he joined Botswana Baylor. He is an active member of the hematology oncology team and has made a positive impact in the workplace and to fellow colleagues. He's an energetic medical officer with excellent manners and clinical skills. And as we know, we're talking about Dr. Kamanda. Charles. Congratulations. So Charles hopes to pursue a residency in pediatric surgery. So hopefully he'll be the second Botswana pediatric surgeon. Congratulations. Thank you.
Keep it running. But it's still trying.
So moving on to our medical officer award. This young doctor is a blazing gun. He's a dedicated and passionate doctor holding a bachelor's degree in medicine from the People's Friendship University of Russia. obtained in 2021. It was during his internship at Marina that he developed a keen interest in pediatrics. He's currently working as a medical officer at Princess Marina Hospital, and he diligently serves in the pediatric department, providing essential care to children. His unwavering commitment to improving child health serves as a driving force, igniting his aspiration to become a pediatrician in the future. So I'd like to call Dr. Bakang Budale.
That's what I...
He sees it.
Yeah.
He sees it.
It's there. I'm sure he's also noticing. And he's like, who's that? Looks like me when I was young.
Thank you. Dr. Budale has a very humble walk, but in the wards. Moving on to our silver winner. This doctor graduated with an MBBS degree from UB. So UB is holding strong, our locally grown, homegrown. She worked as a pediatric medical officer for almost 3 years. I'm surprised she didn't leave in those 3 years and held on because of her passion in pediatrics. This year she joined the MMed program as a resident, and she excels as a team leader, guiding her colleagues with her exceptional skills and knowledge. Her commitment to helping fellow doctors in the wards highlights her strong leadership qualities, reliability, and unwavering integrity. I'd like to call upon Dr. Lizzie Peswa. So to let you know, last year, Lizzie won the award for Outstanding Medical Officer as well.
Keep going.
Thank you.
Okay, it's okay, you can go.
Thank you, Lizzie. Well done.
And then you can just focus on that.
So moving on to our gold winner. So another trailblazing doctor completed her high school in Lekhaye Academy,
Why is he starting from
forming part of the country's inaugural batch in the Top Achievers program. This earned her a double scholarship under the People's Republic of China government scholarship, as well as the government of Botswana, to train for her bachelor's in medicine and surgery in Dalian Medical University in North China. She completed her medical training in Chinese Mandarin. That's powerful.
That was hard.
Making her fluent in several international as well as Bantu languages. She served as an intern and subsequently as a medical officer at Lizola Taibe Memorial Hospital in Maun before joining the program in 2022. She is truly an exceptional doctor, consistently displaying a deep dedication to both learning and teaching. Her commitment to providing the best possible care to her patients knows no bounds, as she consistently goes above and beyond to ensure their well-being. Her remarkable teamwork and harmonious collaboration with colleagues, supervisors, consultants are testament to her outstanding interpersonal skills. So with that said, I'd like to call upon Dr. Aune Titiro. And this is the second year in a row that she's winning the Gold Award. So a big hand for that. May I call all the award winners just to come take a group photo, please? Thank you.
When Dr. Lweto Majani, often called the father of pediatrics in Botswana, was a young boy growing up in rural Botswana, there was a family decision to be made. Would he go herd cattle like other boys in his family, or would he go to school? At the time, in the 1960s, in Botswana, there were very few schools in the rural areas.
and the nearest educational opportunity ended after primary school. One of his uncles, noticing Lueto to be a bright child, pulled the money together to fund his education in the city. It could have turned out differently, Dr. Majani says, while discussing the gratitude he felt to his uncle for making a decision that would change his life. With no medical school in Botswana, Majani was one of the few citizens sent by the Botswana government to the United States to study. After a brief stint at Connecticut College for medical school, Majani was admitted to Howard University School of Medicine. Majani finished medical school and went on to residency in Detroit at Henry Ford Hospital. You remember Henry Ford if you were in the other lectures. Okay. There he specialized in internal medicine and pediatrics because he wanted to have as many skills as possible to take back to the people of Botswana. He finished his training and prepared to return to Botswana. One friend, also from Botswana, asked him if he was really going back, reminding him that finding a job in the US would be easy. Majani, however, never wavered. He was sent to get a medical education, and Botswana needed him. So after his residency, he returned to Botswana, focusing mostly on pediatric care. For more than 30 years, Dr. Majani has served as a pediatrician in Botswana. When he returned in 1989, he was one of only 2 citizen pediatricians in the country. In 1994, he received additional training in echocardiography, and for most of his career, Dr. Majani worked as a pediatrician with a focus in cardiology. Majani has seen it all in his career. When he returned to Botswana in 1989, the pediatric wards of the hospitals were overflowing with pediatric HIV cases. And he was one of the pediatricians working to save lives. He has seen the introduction of antiretroviral, initially funded by the President's Emergency Plan for AIDS Relief, Ep.4, from the United States, and then by the government of Botswana. Despite the intense transition, he states the most difficult part of coming back to Botswana was the fact that everyone thought he was Nigerian, despite his perfect command of Setswana, the local language. The patient's parents were so accustomed to their black doctors being Nigerian that they didn't realize that I was actually from Botswana. He remembers with a laugh. Dr. Majani's resume is outstanding. If only 30 years he served patients one-on-one and served on numerous government committees and research studies. Dr. Majani's heart, though, is in teaching. For the past 10 years of his career, he worked tirelessly to develop a pediatric workforce, working with colleagues to establish a pediatric residency program that has enrolled about 30 pediatricians since its inception, with 3 residents in 2010. At his retirement ceremony, each of Dr. Majani's mentees mentioned that he had taken personal interest in their development, each claiming that they were his favorite. He has that kind of personality. He is warm, inspirational, and staunchly believes in the greatness of pediatrics and of Botswana to teach and nurture physicians, and more specifically, pediatricians. Despite being retired, Dr. Majani continues to see patients in his private practice in Francistown, showing his literally tireless commitment to children. If you can join me in standing.
Did I have a little bit of rhythm?